Hi everyone, Dr. Nemechek here. Just thought I'd put up a quick little video about vaccinating women during pregnancy and why that's important, and the simple reason to understand why this is important. And so, first is recognizing that women during pregnancy have a worse outcome for COVID infection as well as influenza. All right. And so this chart here shows the severity and of pregnant women with COVID versus non-pregnant women. And so here there are three times, the pregnant women are 3 times as likely to be admitted to the hospital in the intensive care unit, 2.9 times more likely to need to be put on a ventilator, 2.4 times to be on ECMO. ECMO is basically they take your arterial blood, they run it through a machine that'll put more oxygen in it and pump it back in the body. So it's like an external lung, okay? And then they're 1.7 times more likely to die. So they do worse, these pregnant women. Now, the primary reason behind this is pretty straightforward, is in that third trimester, women, their immune system is suppressed, okay? And for the simple fact that, so say somebody needs a kidney transplant, all right? The odds are, just randomly, their husband wouldn't match. And if you put the husband's kidney in, the wife would reject it, okay? And so, because they don't match. Well, the fetus is half of the husband's DNA, okay? The fetus wouldn't match either. And so the natural thing that happens is you have this natural immune suppression that prevents the woman from rejecting the fetus, just like she might reject a bad match of a kidney given to her by her husband. Okay? And it's this immune suppression that causes this dramatic increased risk for worse outcomes from infections. Okay? And this is really predominant in the last half or last trimester. So you now have worse immune system functioning. And what happens if you're exposed to a virus? Well, increased severity of infections. It kind of makes sense. If somebody's on chemotherapy and their immune system is suppressed, they do worse too. But here it's the natural immune suppression that's occurring in that third trimester, so the pregnant women won't reject the fetus. Okay? They have, as I said, higher risk of severe illness, hospitalizations, ICU admission, and respiratory failure compared to non-pregnant women. And because of that, and giving them a vaccine, it improves the outcome. So they have less respiratory distress, pneumonia, ICU admissions, and death. And because of that, the fetus does better. Okay? I mean, fetus is under a lot of stress. Mom's got pneumonia or is on a ventilator. Okay? There's a lot of bad things that can happen to that unborn child. Now, the other thing that happens is when the babies are born, they really don't have much of an immune system. They have basically, of their own, they have mom's immune system. They'll have some white blood cells from mom, and they also get antibodies from mom. So the kids will start off with some protection that way. It takes about a year for infants' immune system to become fully functional. Okay, some people say, well, why, if it's not that fully functional, why do they give vaccines like at month 2? Well, they can get some response out of it, okay, and it's to try to protect the child up until that 12-month mark. In those first early months, kids are really vulnerable to infections and bad outcomes. So that's why you have these vaccines early on, and then you'll get a booster later, okay, and they'll have full immunity then. And we know that the vaccines are safe and effective during pregnancy, okay? And there's several studies, both in COVID and influenza, looking, and there's no increase in like miscarriage, stillbirth, congenital abnormalities with mom getting vaccines in that during pregnancy. So I hope that clears it up for everybody. And just as a little reminder, here, you can look at, and the CDC has these maps, and the way they track COVID and influenza, as well as some other unusual things, is through the wastewater. And they can detect particles, or what we call antigens. And as the antigens start increasing, you're going to have the number of cases in the community increase. And so this here is up to about a week ago, and actually this is increasing. These were all this kind of more pale color just a few weeks ago, and as it increases, down here you can see this really dark color. For instance, in January, February, a good 3/4 of the country was at super high levels of COVID. So it's out there, and Europe is experiencing an uptake right now. And we typically follow Europe, so it's going to be increasing here probably in the next month. And so it's still a real issue. COVID hasn't gone away. So anyhow, really getting back to it, the primary reason why women need vaccination during pregnancy is that their immune system is suppressed, and all the things that could go wrong with that when you're infected is kind of what the data shows. All right, hope that helps everybody. It's nice and simple. You all have a nice day.